Can someone tell me, is my screen clear?
Yes.
Okay. So yesterday we were discussing about more about injections, isn't it? We were seeing that there are four different ways of giving injection, which is very common: intramuscular, subcutaneous, intradermal, and intravenous. And we saw the differences between each of those, which in which of the method the absorption is faster, absorption is very fast, and the one which is very slow. Okay, and what are the purposes? For example, why do we give intradermal injections? It is mainly to test for allergy and to check whether patients have tuberculosis. Okay, today we'll go on to the last part of medication, that is topical medications. Okay, this is a very small portion. I will finish it, and then I have another PowerPoint where I will be talking about all the drug calculations, some more very simple sums and also some difficult sums. Okay, so we will be working out together. I hope if you can have a calculator with you during that time, it is easy. Okay, so topical medications, the name as it applies, you can understand that it is going to be put on the surface of the body. Okay, so the medications which are applied either locally on the skin, or it can be even the mucous membranes. Okay, mucous membrane of the mouth, or mucous membrane of the rectal region or vaginal region, or mucous membrane which is there in the eyes or nose, all these together. So we can divide them into dermatological one, which is applied to the skin, or we can call it as instillation or irrigations. Like for example, some big foreign body has fallen onto the eyes or ears. Okay, so how we, with the help of a very big syringe, how we irrigate. Irrigate means wash it out. Okay, that we can read. Then what is instillation? Putting eye drops or ear drops or nose drops, some medication into those cavities. Okay, and the other one is inhalation. Inhalation is directly into the respiratory tract, how we can inhale the medications. We will see about all these things. Okay, the first one is uh, medications which we instill into the eyes. As you know this terminology, it is ophthalmic medications. Whenever you want to put anything into the eyes, they are called as ophthalmic medications. Okay, so where are we applying these medications? Into the conjunctiva. All of you know it is the down part of your, the lower portion of your eye. If you pull it and see, you can see a sac, a bag like thing. Okay, in actually we are going to put the medicines into that conjunctival sac. Okay, and can any of you tell me, when we are crying, okay, the you can feel the tears, the salty tears in your throat. Sometimes it comes through your nose. Can anyone tell me why? It's just anatomy question. You have learnt already in anatomy. Anyone?
It's okay, maybe because to kill the
Yeah.
microbes and any microorganism that can enter to the eye.
No, no, no. I think you did not understand my question. My question is, when we are crying, maybe someone scolded me, and my mother scolded me, so I'm crying. My tears goes into my nose or into my throat. I can feel or I can taste the salty tears there. How does that happen? That is my question.
Because
And notes have the same tract.
Okay, what is that tract called? Very good.
nasal lacrimal
I have
duct.
no idea.
Yes, yes, very good. Nasolacrimal duct. Okay, so it is in the inner canthus. Yeah, when we were giving bath, we learned to know there is something called inner canthus, which is near the area where the nose is, nasal cavity is starting, and you have outer canthus. So why I want to inform you is, there is a nasolacrimal duct, and we call, if you, I want you to see each other's eye when you're free, or your own eye in the mirror. Okay, in the corner you will find a small hole. Okay, it is called punctum. You have already learned all this in anatomy. Now, what happens when we apply eye drops? Okay, the medicine goes into the punctum and it enters your nose or into your throat. Okay, that is how you are able to feel your tears. Now, this is the same thing which will happen when we are going to apply the medications also. So, where are we supposed to apply the medication? In the conjunctival sac. Okay, you can divide the conjunctival sac from inner canthus to outer canthus into three portions. Okay, we are going to show this in the lab to you, don't worry. So you can divide it into three portions, and in the outer, okay, outer canthus area, do you see in the ointment where they are applying? Okay, we apply either the eye drops or the ointment in the outer one third of the conjunctival sac. Okay, and you ask the patient to close the eyes. So the medicine goes all over the conjunctiva. Now, to prevent it from entering into the nose, we need to just close the punctum for few seconds. You can even tell the patient to do that. Anyway, we are wearing gloves. We are going to clean it first, clean the eyes first, and then we are going to apply this medications. We'll see the procedure soon in the lab. Okay, but you have to be very careful. Why we are putting on the outer canthus or outer conjunctival sac? Because before it reaches the punctum, we can keep our hands and just press mildly over the punctum so that the medicine does not go inside. Okay, and what is the position we are going to put and all that we will be seeing. And if you have to apply two, okay, there is a order for ointment, apply drops and wait for 5 minutes, then you can apply the ointment. Okay. When there is some lot of cracks which are very hard, or there is some ear infection, okay, and some itching or some other problem is there in the ears, we will be using the ear drops. Okay, now what is the area we are going to put the ear drops? Okay, when we are opening the ears, we are going to put it straight. We are not going to put it over there. We are going to put it in the outer canal. Okay, you know outer canal is from, this is pinna, then from is a canal, then you have the tympanic membrane, middle ear, isn't it? Now, the arrangement of the canal, eustachian tube, is different for children and adults. Okay, any of you have any idea? Anything related to that, you know? Is it different in children and adult, or is it the same? Yes? Okay, let me not waste my time. See, children under 3 years, you need to pull their ears down and back. See, what I have shown in the picture is, do you see the hand of the nurse who's instilling the drops? This is an adult person. So the pinna adult and also any children above 3 years, okay, to straighten the ear canal, we need to pull the pinna up and back. Okay, only below 3 years, down and back, because the eustachian canal till 3 years is not developed. So we need to follow these procedures to straighten the canal, and then you can instill the ear drops. Okay, supposing you need to give for both the ears. We will show you the right procedure when you come to the lab. So you will be installing ear drops, you will put a small cotton, and you make the patient wait for 5 minutes at least. Then you turn to the other side and then put the drops. Immediately if we put, what will happen? When you turn to the other side, this ear drops will come out. Okay, procedure we will be seeing. Okay, nasal medications. How are we going to instill medications into the nose? Okay, most of the time, all of you know about it very well, especially for small children when they have a lot of flu and cold and nasal congestion, lot of secretions are there, they cannot even breathe. You know why they cannot breathe? Because there is, the mucosal membrane has swollen. So there is no way for the air to enter inside or come out properly. So to reduce the congestion, nasal congestion, or to reduce the allergy symptoms, okay, we can either use drops or spray. I'm very sure many of you know about it. When we want to use spray, just sit upright, just lift little bit, you can extend the neck, and then you yourself can apply it. But when it is going to be for the sinuses, okay, you know about the sinuses. Anyway, I'm not asking the question because the picture itself, I have written the name of the sinuses. We have ethmoid, sphenoid, maxillary, and frontal sinuses. Okay, so when we want to treat sinusitis, inflammation of all the sinus in this facial area, face and the forehead area, how do we instill the nasal drops? Do you see in the picture the patient's head is hyperextended? So the pillow has literally been moved to the shoulder side. So the patient's head is hyperextended. Now you have to instill, okay, both the noses, maybe most of the times all these drops are 2 drops. Okay, so it is instilled inside and the patient remains like that for few seconds at least, and then we give them instruction not to blow the nose immediately because the medicines will come out, and other instruction is they can breathe through the mouth for few minutes so that the medicine will be absorbed carefully. And if you want to apply medications to maxillary and frontal sinuses, you see the second picture, hyperextended, but turn to one side, the head. See, when you want to apply for the left side, turn the head to left side. When you want to apply for the right side, turn the head to the other side. Okay, and then we will be instilling the drops. All other instructions are the same. Okay, so this is about the nasal drops. And sorry. Okay, what are some of the skin applications? Okay, they call it as percutaneous. Percutaneous means cutaneous is skin, percutaneous is through skin. Okay, what are all things we are going to use? We are going to use something called transdermal patch. In the next picture, I will show you what is that. Okay, then other skin applications like cream, jelly, lotion, all of you would have definitely used all these things. Spray, some powdered medications. Okay, we can use all these medications. Do you see in the first picture? See, this is some fungal infection which is seen in the hand of this patient. Okay, so most of the time we will be applying either lotion or some cream, or sometimes it is the powdered medication. Okay, everything we are going to demonstrate in the lab exactly how we are going to do. So this is mainly to treat some infection, or sometimes it can happen that some abrasions. You fell down and this whole area is red and some bloody skin is gone off. Okay, abrasions are basically there is no skin and the next layer is opened and it is burning. So such situations we will be applying some lotion over there. So it gives a cool and soothing sensation. Okay, the second picture is the patch. Okay, patches are, it can be this like a micropore tape, or it can be like a sticker. Okay, some circular sticker. You know, what is this sticker? This sticker looks like a transparent one, but it has medication inside. So we just remove the sticker part of it and apply it in the skin of the person. Okay, nowadays this has become very, very popular because this has become a mode of treatment for cancer patients. We have a lot of cancer patients in the hospital who are suffering from severe pain. Rather than giving pain medications and pain injections, pain medication through mouth and pain injections, nowadays we are using this transdermal patch. So it is applied on the skin where there is not much hair, and preferably on the upper portion of the body. So either on the chest or at the back or in the upper portion of the arms. Okay, we can put it there, and this medicine will be slowly going into the skin and it is going into the blood. Okay, most of the time it is the pain medications, and from 1 hour up to 1 week, these medications can be there. One sticker can provide even for up to 1 week medications. Okay, so we have a lot of medications like that. It is released very slowly into the skin, and patients are feeling the analgesic effect. There is no pain for the patient. Now, there are some instructions when we are using this, and like we have to be very careful how we apply it. If we are not wearing gloves, if we are not careful, when we are touching and putting it on the skin, the medication can enter inside the skin of the nurse. Okay, and the other point is when we are disposing also, we have to be very carefully disposing it inside the gloves and throwing it. Okay, and each time you need to change the different side. For example, if I have used the right hand of the patient first time, okay, 1 week over, I want to change the medication. You choose another site. The site which you have used previously, you are not allowed to use it for the next 1 week. Okay, you cannot use the same site for one more week. Okay, so like that you need to rotate the site so that that area is not affected anymore. And if there are hair in that area, we are not supposed to attach it over there. And just give me a minute. I'll just switch off that phone. I'm sorry. Okay, so these transdermal patches are becoming very popular because it serves as a very good uh, mode of administering analgesic for these patients. Okay, without much complications of oral and other routes. Okay, and also now I read somewhere in your book, I have read that now there are a lot of researchers which are going on. They want to make it as active patches. Okay, now it is only the pain medications which they are using, or I have heard them using it for reducing BP. For example, when the surgery is going on, patient cannot be given medication orally, and it's dangerous to give intravenously as injection also. So such times, if the BP is going higher, they are using nitroglycerin patches to reduce BP. But in future, they want to use this patches for delivering insulin, because we know diabetic patients are everywhere. Diabetes is increasing day by day. Definitely in all our houses there are one or two people with diabetes. So I think this research, if it comes out successfully, it will take care of the need for giving insulin injections very frequently. Okay, let us hope for the best to come. Then the other route, as I said, it is inhaled medications. Okay, I'm sure most of you would have seen many people taking something in their mouth. It makes a noise, and one spray of medication goes into their mouth. Okay, so they are called metered dose inhalers. As you read it here, MDI. They are called metered dose inhalers. Okay, why it is called metered dose inhalers? See, we will show it. We will show the real thing. But when you press one time, the amount of medication which goes inside is measured. That's why we call it as metered dose inhaler. So usually they write 2 times, 2 puffs. 2 puffs are equal to 250 milligram of medication. So like that we can measure the medications. The same medication can be given in powdered form also. Okay, this looks like a small disc. This is filled with powder, and this powdered medication also can be inhaled. Okay, the procedure, how we are going to do, what instructions we need to give the patient, all that we will see in the laboratory. Okay, so inhaled medications are the mist or the fog which is formed from the medication, and it goes directly into your respiratory tract. Okay, most of the times it is for asthmatic patient. Asthma patients have bronchoconstriction. Okay, many of these drugs are bronchodilators. So whenever they feel that they cannot breathe anymore, they take one puff. So it dilates their bronchus, and they get a great relief. Okay, many patients are using this metered dose inhalers. And when it comes to children, there is something called space inhaler. When you go to pediatrics, you will learn about it. Okay. Now, the other medications which can be given topically, as I said, there are some medications which are given in the vaginal region. Okay, there are some irrigations which are done in the vaginal region. Some infections are very common over there. So, to treat infection, there may be cream or jellies or some irrigated medication. Medicated irrigations are given. And rectal medication also we are going to see in the lab. I hope you all remember the position which, when we were teaching about positions, we said about semi-prone position, isn't it? Semi-prone, or you call it a Sims position. So this position is using rectal suppository, okay, and there are for children they use it for reducing fever. So paracetamol is available as suppository, and there is a medication called Oviron or diclofenac which is given for pain. So post-operative patients, they give that. Or sometimes there are patients who have constipation, they cannot pass motion for 4 days, 5 days. So this is like a waxy nature. It will be inserted into the rectum, and it gets dissolved, and it starts its action from there. Okay, because rectal area is filled with a lot of blood supplies. This medicine goes to the blood and it starts acting. Okay, so rectal medication, rectal suppository also is a common way of giving medications. And when we were discussing about the skin, I just said about skin medications, but there are methods how we can apply lotion, how we can apply spray, how are we going to apply the cream. See, for example, as I showed you one infected area, isn't it? See, this is the infected area. The next one is for releasing medication into the skin. There can be, for example, boys are all very interested in playing football over here. So when you're playing, you have some injury, some sprain, immediately we have the sprays which can reduce the pain and inflammation. So we can spray some medications. Then in case of chicken pox and severe itching, you would have heard about lotion, like a milky pink color lotion which can be applied all over the body. So each one has a different procedure. We will be discussing about it in detail when you come to the lab. Okay. So what are some of the nursing diagnoses? This nursing diagnosis is for all injections and everything. So when we think about injection, what comes to our mind is anxiety, I feel, because anybody is scared to take injection because it is painful. And most of the times, like health seeking, ineffective health maintenance, okay, once they are not taking care of themselves, then we need to give all injections and medications. Health seeking behavior is relevant to the vaccines. Okay, most of the time we need to take vaccine, or I want to know whether I have any allergy, or I want to know whether I have tuberculosis. So health seeking behavior of the patient makes us to give some injection to them. And then very, very important, most of the time, though they may be educated patients, but they are new to the medication, whatever we are prescribing to them. So there are small health education which are needed whenever we administer medication. This is for your pain. This can cause some gastric irritation. This medicine you should take after food. This medication you should take before food. This medication is only at the bedtime. Okay, like this, lot of knowledge deficit is there for the patient whenever we are administering medications. And then another important problem is non-compliance. Can anybody tell me what is non-compliance? Girls, boys?
The patient can't follow or not follow the prescribe of the doctors.
Yes. Okay. This happens, very good. This happens with elderly patients, isn't it? They are having hypertension, they are having diabetes, they are having some heart disease. How many medicines they will take? So at one point, they themselves will say, okay, doctor has given me 5, I will take only 1. But it is going to be very dangerous, and they end up getting admitted in the hospital because they were not compliant, because they were not following what was informed to them. Okay, so we need to explain about the importance of it. And there even for children also, sometimes if they have fits or epilepsy, okay, or some other chronic diseases, they also may have to take for 2 years or 3 years medications continuously, which we need to explain to the parents what is the importance of it. If they leave for 1 or 2 days also, it can lead to bigger problems and complications. Okay, then about the eye medications when we are putting. Sometimes it is the patient who has undergone eye surgery. So we may be applying medications continuously. Sometimes we put even dressing over the eye. Okay, so we can say disturbed visual sensory perception also. Sometimes even disturbed hearing, we can say, if we have applied medications, put cotton inside, or if they have thick wax inside and we have applied medication to soften it and they cannot hear properly because of the wax. Okay, we can say that. Then there are some patients we come across impaired swallowing, so they cannot take oral medications. Either the doctor has to change it into injection, or if they are on NG tube, we may be powdering, mixing it in the water and pouring it through the tube. Okay, we will be using that. Then there are some patients who can manage the therapeutic regimen. Therapeutic regimen means, okay, you need to take this injection, like for a diabetic patient, you need to take insulin daily, or for a hypertensive patient, you need to take this medication every day, morning and night. Okay, those things. There are some who can manage it very well. There are some ineffective therapeutic regimen management. As I said, non-compliant. Okay, so many diagnoses we can make based on the problems we come across with the patients. Okay, most of the times when we are administering the medications, so be very careful. You should not be distracted. No one should be interrupted while preparing and administering, because your concentration should be there completely. As we saw in the first slide when I started, what did I say? Once you give the injection, it cannot be irretrievable. You cannot take it back. So you have to be very careful when you are preparing itself. You can never take more dose of medication or lesser dose of medication, especially if you by mistake, if you were talking to someone and you were slowly preparing, not at all concentrating. If you are going to give a double dose of injection to a child, the child can even die. Okay, so we have to be very careful whenever we are going to administering medication. Okay, so when you are going to administer, you have to be carefully reading what is the prescription written. If there is any doubt, you can always ask the pharmacist, call him and ask, I think this the patient is saying the color of the medication what he is taking at home is different from this. Is it a new version of it, or have you given some other wrong drug? You can always check with them. Okay, and if the patient has to continue with some of the medication at home, social worker and community nurse can help them, visit them, explain about all these things to them. Okay, and as I said, family teaching is very important. Patient teaching, if patient is unconscious or patient cannot understand very elderly people, teach the family how they should give it. Okay, when you're in an emergency situation, one doctor is calling you and telling you, okay, can you give these medications? When I reach the ward, I will give, because the patient cannot wait. The patient has, for example, high BP and he has fallen down, he has fainted. So you need to give some medication which is in emergency. So when you receive medication order through the phone, write it down, you read it back. Okay, is this the one did you order? Okay, as soon as they come, see that they are putting the order with their signature and everything. Okay, and always be very careful when you are writing, when you are communicating, and dosage calculation. I think some of you have already started with medication administration, so you will know how careful we should be when we are going to administer medication. And if you have not given, see, for example, you have taken, everything is ready, don't go ahead to write that, okay, administered. Don't put your signature till the patient takes it. You know what can happen? You would have prepared. When you go to the patient would have refused. So after completing the procedure, if you see that the patient has taken only, you can document the procedure. So these are some things which you should keep in mind. Okay, and sometimes the medication what is available in the hospital when they were admitted is little different from the polyclinics or the health centers where they are continuing their medication. So all those things, let them be careful whether they are taking the right dose and the right medication. You should give health education. See, that's why we have put that as a first one. Client and family teaching is very important throughout. Even when they are getting discharged, you need to be explaining it to them. And then evaluation, effectiveness of the intervention. Always you should go back and check. See, for example, you gave for fever, or you gave for pain, or you gave for some other problem, BP. You need to go back and evaluate. Was it effective? Do I need to give medication again? Or how are they feeling now? All those things we need to go back and check. Okay, that's all for medications. If any of you have any doubts, then we can clarify it. Otherwise, I will go quickly to our major discussion, which is the drug calculation. Any of you have any questions?